Thank you for viewing my poster titled Establishment of Preclinical Mechanistic in Vitro in Vivo Correlation for Long-Acting Injectable Suspension. This poster was previously presented at AAPS in October 2022. We're excited to show it here during MIDD Plus 2023 conference. This work is a result of an ongoing FDA-funded collaboration with the University of Connecticut, and I'd like to acknowledge all authors listed alongside me. Before moving on to the presentation, I'd like to point out that there's not a live Q&A session for this portion, so feel free to contact me at the listed email here with questions or to discuss this work further. So long-acting injectable formulations, and I'll be referring to it as LAIs, they can be administered through the subcutaneous or intramuscular routes, and they provide a sustained drug release over an extended period. For long-acting injectables, or LAIs, formulated as crystalline suspensions, the extended release is obtained through the formation of an in situ drug depot at the injection site, and from this depot, a poorly soluble drug can slowly dissolve and subsequently be absorbed into the systemic circulation. Nevertheless, the development of complex generic LAIs is challenging since the relationship between the solubility, particle size, in vivo release from a parenteral suspension has not yet been established systematically. So in this scenario, the use of modeling and simulation may provide a unique opportunity to mechanistically understand the in vivo release of drug from LAI suspensions and drug disposition. And the establishment of mechanistic in vitro in vivo correlations is a valuable approach to further product development of LAIs. So the objective of this study was to use different modeling approaches to mechanistically understand the in vivo performance of LAIs in preclinical species and to establish an in vitro in vivo correlation. For this particular study, Depot Sub-Q Provera 104, which is a subcutaneous suspension of medroxyprogesterone acetate, which I'll be referring to as MPA, was used as a model drug product. As highlighted before, this is a work that's been done in collaboration with the University of Connecticut. So all the in vitro and in vivo studies in rabbits were obtained from either published data from the group, and as well as our ongoing collaboration with Dr. Burgess' lab. In this case, we had an RLD product, or the reference listed drug product, as well as 3 different formulation variants. On the modeling side, a mechanistic PBPK model for MPA was built using GastroPlus version 9.8.2, and all tissues were modeled as perfusion-limited tissues. The tissue plasma partition coefficients were calculated using the Lukachova method, and the physical, chemical, and biopharmaceutical properties were obtained either from the literature or predicted from structure using ADMET Predictor 10.3. As I highlighted before, the objective was to use different modeling approaches, and the 2 approaches taken to predict the in vivo dissolution were the first one was based on the drug solubility and particle size distribution. And the second one was a mechanistic in vitro in vivo correlation using time scaling through Levy plots. In the drug solubility and particle size distribution approach, there was the need to scale the in vitro measured particle size, and that is due to particle aggregation that occurs in vivo. When we're talking about the subcutaneous space, we have a much more restricted environment, and so particle aggregation may occur, as it has also been reported in the literature. So for that, the measured particle size was scaled, and what is important to highlight here is that the same scaling was used across all formulations. So across RLD and the 3 formulation variants, the same scaling from in vitro to in vivo was used. In the mechanistic IVIVC, as I highlighted before, a time scaling approach had to be taken. In the in vitro release studies, it was a more biorelevant setup. Nevertheless, the in vitro release time was roughly about 1 week, whereas in vivo we have a release extended over a period of 3 months. So because of that, we had to plot and obtain that correlation between the in vivo time versus the in vitro time, and built a correlation that was using formulations F1, F2, and F3 as an internal validation. And then the reference product, Depo sub-Q 104, Provero 104, was used as an external validation. One thing also to keep in mind is that whenever something is administered subcutaneously, inflammation can occur. And the result of inflammation can be that 1 to 3-fold increase in depot volume over time due to that tissue inflammation. So this process was included in our PBPK model. And the same fold increase in the depot volume also was used across all formulations. So the reference listed drug, RLD of MPA, and the formulation variants had the same inflammation parameters included in the model. Now coming to the results, the developed PBPK model for MPA adequately describes the plasma pharmacokinetic profile of MPA following intravenous administration in rabbit with an R-squared greater than 0.77. The graph is not shown here. And then we moved on to predict the subcutaneous, the exposure after subcutaneous administration. So once the distribution model had been set up, we were confident that any discrepancies between observed data and simulated profiles would probably come from the absorption aspect of it and not the distribution. As I had highlighted before, the experimental particle size distribution resulted in an overprediction of Cmax and AUC, whereas the scaled particle size distribution resulted in a more adequate prediction, as shown here in Figure 1 on the left-hand side. In this set of simulations here, we are showing the particle size, the scaled particle size distribution, but not taking into account the inflammation yet. So here we see that especially the end tail of the profile is very well captured using this approach, and overall the profile shape is somewhat well predicted, but we see there, especially for Cmax, we are missing out on Cmax. So the next step was then to include that inflammation in the model, and whenever that was included, we see that a much better result. We were able to obtain much better results with the profile shape being very well captured. And here we see that the inclusion of inflammation parameters in the model resulted in better Cmax prediction with a lower average absolute predictor error, while maintaining AUC average absolute predictor error below 10%. And below 15% for each formulation. Moving on to the second approach taken in this study, which was the IVIVC. In Figure 2, we can see the results here. Formulations F1, F2, and F3 were the internal validation, whereas the RLD was the external validation. So the IVIVC using the time scaling approach resulted in an overall reasonable prediction of plasma concentration in rabbits. The Cmax and AUC percent error, prediction errors, were within 12.3 and 17.8% respectively. And we see here that the shape of the profile was accurately predicted, but more studies need to be done in order to refine this approach. And as I said, this is an ongoing collaboration, so more efforts are being put into furthering this approach. As a conclusion, we see that utilizing the same scaling between in vitro and in vivo particle size distribution across all formulations and varying the depot volume over time because of inflammation resulted in reasonable prediction of MPA pharmacokinetic profiles. The larger effective in vivo particle size can be related to in vivo particle aggregation. And this shows the utility of in silico tools for mechanistic understanding of in vivo product performance. The mechanistic in vitro in vivo correlation approach also resulted in a reasonable prediction of MPA profiles, as demonstrated by average absolute percent prediction error below 10% for both Tmax and ASC. Establishing IV-IVC for long-acting injectables is challenging, given the need for time scaling seen by the higher prediction errors for area under the curve for RLD. Hence, further studies are needed to refine this approach. Thank you once again for coming and for viewing our poster. And if you have any questions, please don't hesitate to contact me at my email here. Thank you very much.